the nurse's station, and I have documented the times that I gave Miss Bird's LASIK and her Rocephin. So that has been documented. And now we're going to fast forward. It's been a couple of days now, and or I should say an hour has passed. I think that's what we decided our scenario was. And I have an order to take out her IV. But before I do that, there's some things I want to check in her chart. Let me see how well she has been urinating. I want to check her lab values and see if they are within normal values. I see her white blood cell count is coming down, so that's good. And she's been eating and drinking very well. Okay, so if I had found anything abnormal, I would notify the doctor before I took her IV catheter out, just to make sure he was aware of the situation, because he may would want to keep it in. But I don't see anything in her chart that would keep us from taking that out. Okay, so now I need to go to the medication room and gather my supplies. Okay, I'm just going to need some tape and some gauze, and I'm going to take some alcohol preps. If you have a Band-Aid, you may use that. Okay. Well, hello, how are you today? Okay, well, I'm back to take out your Miss Bird, what is going on here? You have got yourself all tangled up. Oh my goodness. Just a minute. I will help you. Let me wash my hands right quick. Okay, I'm going to set my supplies right here. Miss Bird, how did you get all tangled up? Oh, you got up to go to the bathroom. Well, you didn't call me. Oh, goodness. I am so sorry. Are you okay? Was that it wasn't too tight around your neck. That was very dangerous. Okay, so you're all right? All righty then. Okay. Oh, that scared me. All right, I'm here to take out your IV. So I'm gonna put your arm up under this pad to keep your bed all nice and clean. I'm just gonna set my supplies right here on your pad. So the first thing I need to do is turn your IV fluids off. So I'm going to put on a pair of gloves, because whenever we handle IV tubing in the patient's room, we need to have gloves on. So I'm gonna get these on. And walk over here to your IV pole. Okay, now this is finished dripping, so that's good. I've turned it off. Now what is going in now is the normal saline. So when the Rocephin finished, this normal saline started dripping. And it has the same drip factor this tubing did. They happen to both be the same. They may not be the same always, but in our case they were the same. I saw that on the little bag they were in. Okay, so that has been infusing to flush that very well. Okay, so I'm going to go ahead and turn that off. Now, after I have disconnected it and got the patient all situated, then I will come back and I will empty this bag into the sink. Okay, alrighty. Can you give me your name and your date of birth? Okay, that is right. And I have the order to take out your IV, so I'm going to disconnect it right here. Just put it over the IV pole. Okay. Now then, I want to start taking the tape off, and I will be as gentle as I can. It's pretty sticky. I want to get all of this off. Now, if it sticks too much, we may have to use a little adhesive remover or some saline or some alcohol, but we want to remove all the tape.
I don't have to worry about taking it off this tubing because the tubing will be thrown away. And support the skin. Press down with one finger on the skin while you're pulling up on the other. Okay. Alrighty. You want to stabilize the catheter. Make sure that you do not pull the catheter out. Okay, let's see if I can get this tape off. Okay. Alrighty, now then, while I'm still holding the catheter, I'm going to take some alcohol and I'm going to scrub at this site here. Now you want to just kind of do it I said scrub it, we're going to do it gently because we don't want to hurt the patient by putting pressure on this catheter. So I want to get it good and clean. Okay, then I'm going to take a piece of gauze, put it, just apply it over the top, and I'm going to pull it out very gently. Okay. Now while I am holding pressure, I'm going to look at the IV catheter. I see it got kinked up a little bit while it was infusing. The tip looks good and it looks like it's the right length. So I'm confident that this IV catheter has good integrity. Now I'm putting pressure on this, and you want to do this for a couple of minutes. But you need for sure do it for at least 30 seconds before you even check to see if it's still bleeding. So I've been putting pressure for about 30 seconds, so I'm going to take a look. Okay, it looks like it has stopped bleeding, but I'm going to go ahead and get ready to put a clean piece on, and I'll just fold it over, and then I'll remove this piece, put the new piece down, and then I will take some tape and put that in place. Okay, now then, the site looks really good. I don't see any redness or swelling. It did not feel warm to me. Miss Berta, have you had any pain at all? Everything feels good. Okay, well that is good news. All right, so we have, now I'll just need to clean up the supplies here. In my wastebasket, I'm going to take my gloves off. Those in the basket. Now then, I want to make sure, wash my hands again. I want to make sure that Miss Bird's bed is in low position. Are you comfortable? Is this how you want to lay? Okay, and her call light is in reach. Alrighty, well, I will be back in a little while to check on you again. But if you need anything, please call me using your call bell, okay? All right then. Okay, so that is the end of this demonstration, but then you will need to go and document the procedure for taking out the IV catheter. On your video, you'll need to read that documentation out loud on the video. I hope you have fun putting your video together, and I've learned quite a bit. I've learned about splicing and dicing and redoing and starting all over and looking at the camera. So this has been quite a learning experience for me in just the technology part of it. Okay, well, I will see you again tomorrow. I'll be making a couple more videos tomorrow, and I think that'll be or maybe two or three that I'll be making tomorrow from the school. And that will be the end of my part, and then I will look forward to seeing you in July. Okay then, bye-bye.